seen with one's own eyes gives credence to exactly what happened. As I peruse around in this first video of a lung section, you can see that there is extensive hemorrhage. And we're going to go down to show you, look how very normal the lung is otherwise. Nice aeration, nice dilatation of the alveolar spaces. And I'm just going to keep on perusing around, but let me go and show you that this is evidence. This is factual. This is not someone's opinion. You can see that there's evidence of recent. You can see the hemorrhage in the vascular around the vascular spaces and the alveolar channels. And you can see evidence of, I'm going to go down to show you, I usually take multiple sections of lung tissue. So you can see that there's, you see some bronchial cells and some alveolar histiocytes, which are normal to see sometimes in a deceased person. This person had been dead for some time, discovered dead like a few hours after death, while should be under surveillance of our 24/7 nursing home care. But let me just continue to peruse around because you can see the evidence of hemorrhage here. But I want to show another slide. Here's another slide of lung tissue. You can see that there is extensive hemorrhage. And I believe this hemorrhage may have been coming from the tracheotomy site. And there was evidence of both recent and remote hemorrhage. And I'll tell you, this is all recent, evidence of recent acute hemorrhage. But I'm going to show you when I see it, I'll go down to show you the how we determine if it's evidence of remote hemorrhage. And there are some areas right there around a blood vessel. We're going to show you the hemocyaninate macrophage. This is evidence of old hemorrhage. So obviously we have evidence of recent hemorrhage, and with these pigmented histiocytes, evidence of remote hemorrhage. So this is, most of her lung tissue look like this. If you see otherwise, they're very aerated, nicely aerated. There is no fibrosis, and there is no evidence, no histological evidence of active COVID-19 disease, as this person, that's just calcified plaque, actually calcified debris. I'm not sure if that's plaque, but be that as it may, normally you can see changes with COVID that has already been defined, and I've talked about many cases of COVID. This is not a COVID-19 lung. Okay, so we're going to go into the next histology, which will be the heart. So here's a section of the coronary artery. You can see that there is no significant plaque disease. We're going to go to the next slide. Oh, I think I got some myocardium on this slide. You can see that the myocardium is normal. Yeah, I think I did put some of the myocardium on this slide. Here's the myocardium. That's normal myocardium. No evidence of ischemic heart disease or acute changes of the heart, acute myocardial infarction like in a heart attack. So we'll go to the next slide. Here is sections of liver. You can see that the liver is completely necrotic, perhaps due to a failing heart without or oxygen, or lungs without oxygenation. So I'm gonna go down just to convince you that this is definitely liver tissue, just all necrotic from ischemia. And you can see even a little either bowel pigmentation increase or whatever, and there's some little slight information around the portal triads. But look at how necrotic these liver cells are, the liver plates. And now part of this is autolytic changes from the person had been dead for some time, but I think also a part is evidence that there is not good vascular perfusion or oxygenation in the liver tissue, which tends to be very well perfused by blood because of the portal veins and portal arteries, as well as other hepatic arteries going into the liver. So it gets a good deal of blood supply, and you can see that this is all necrotic liver cells. Here is a section of spleen, and it too looks okay. A little edema going on with the spleen, but you still see the usual red and white pulp. We go to the next slide. Here is sections of kidney. Let's just go down to show you. You see some glomeruli which look like they're okay, obviously degenerating. But look at the surrounding tubules, completely necrotic. We call that acute tubular necrosis, perhaps due to cardiogenic failure. In other words, the heart stopped, or either not getting much oxygen supply from a failed lung respiration. So you would love for you can see the glomeruli are intact. You can see the vessels are good. There's no kidney disease here whatsoever. other than acute tubular necrosis from, again, cardiogenic collapse, cardiorespiratory collapse. We'll go to the next slide. As usual, I usually take multiple sections of kidney, so you can see another section of kidney. Again, acute tubular necrosis. Let's see if we can get some of the medullary component of the kidney. This is all cortical. That's where you see the nephrons, the glomeruli, and so forth and so on. And then as we go down, I think that we're getting into the medullary component, and that's all normal looking renal tubules, okay? Like the exiting, collecting ducts, and so forth and so on. Those are all normal. Okay, we'll go to the next slide. So this was segments of a random section of gallbladder. You can see that the gallbladder is ischemic and fibrotic. The person had a gallstone that went undiagnosed. She had been in the hospital, and you can see that this gallbladder is inflamed. And let me see if I can go around to show you evidence that this is indeed gallbladder tissue. I think I have a better section. This is all denuded necrotic gallbladder tissue, gangrenous gallbladder tissue. Let me see if I got a better section of the gallbladder. So here's ischemic appearing. I think this is intestinal tissue. Yeah, you can see that the glands are all autolytic or either necrotic from ischemia. And that's far in the matter. That could have been from me with the autopsy. But anyway, you can see that. Let me see if I can go down just to convince to you that this is ischemic changes in this tissue, because you can see some extravasated red blood cells. If I thought I had, you can see that the glands are all autolytic or dying. Let me see. While it doesn't come into view here, there was definitely some extravasated red cells, but this is definitely ischemic changes too. So not all on autolytic changes from dying due to post-mortem decay. And finally, I take sections of bone marrow. You can see that this person obviously got adequate cellularity, and I'm going to go down into a more cellular area like in here. That's a good section to look at bone marrow tissue. And you know, you get people saying that, oh, you can't examine bone marrow that well on telepathology. Well, you see here that you can see bone marrow cells without even oil immersion. You can see nicely description of marrow elements, megakaryocytes, myeloid cells, erythroid cells. They're all here in normal in amount and morphology. So looking nice eosinophils. These are maturing eosinophils. The one that you see that look orange like, those are nicely formed eosinophil cells. Nice megakaryocytes. All normal in this person who simply died from obstructive tracheotomy site that was bleeding and clotting and lack of oxygenation. Just really unfortunate. A very acute death, as you don't even see that much in the erythroid hyperplasia, although I think there is some here. Obviously, before she died, it had to have been. You can see when you see increased megakaryocytes, you normally don't see megakaryocytes this close together. So when you see that, erythroid and megakaryocytic hyperplasia usually go together. All right, that's lesson 101 in histopathology. You know, you listen to these other folk who want to tell you by opinion. I show you the evidence, and that's why I keep my practice completely transparent.